I feel like your practice insurance, your CMPA coverage would have long no longer been required by the time you get to, year 39, and then you get a
Yeah.
flood in your basement and the record dissolves. Like, then
Yeah.
what?
Yeah, and we've had a call where physicians called us to their house, and we go in, and it was a flooded basement, and so then they're trying to pass on the files to us after they've been damaged by a flood. So,
There's
it's
a big soggy mess
yeah,
for you.
exactly. You can't quite have it both ways like that. So, and like I said, we've been focusing on retirements and physicians that have been practicing their whole life, but there is the other component where again, covered with your conversation with Dr. Sharma, is younger family physicians have a different mindset. They're not working the 5 or 6 days a week and seeing as many patients as possible like the previous generation, because they've been disincentivized to do that. So we are seeing more commonly younger physicians, they're spending time in an area and then they're relocating to a different province or a different practice area. And it's same with them, is they just want to be able to close up what they're doing and not have to kind of continually readdress requests and follow up. So even if they, in theory, have the capacity to try and manage it, they're trying to move to a different area. They're trying to focus on a new venture in their life, and they don't want this kind of keep coming back constantly. So that's another thing that's becoming increasingly common as well, is seeing younger physicians relocating and transitioning. So again, all the same things apply with the practice closures and retirements, but for these scenarios.
So let's assume we're going to be a good boy and get this sorted out ahead of time before disaster strikes or before retirement is, just around the horizon. What do we got to actually do to, premeditate and have this all set up in a nice, orderly fashion?
Yeah, so we have a 12-month checklist that we provide to physicians, and what's nice about this checklist is, and this has happened before, is even if we go through the entire checklist and we get to we're nearing the closure date, we've had physicians who continue to say, you know what, I'm going to push this off 30 days, 60 days. And we're okay with that because we started the process early enough that we can accommodate those changes. So like I said, 12 months out is when we start with the physician and we build that plan. So we send them our checklist and we go through, for the first 6 months, it's a lot of administrative items and tasks that are really have less to do with the record management, but it's more about organizing them and their operations, so that the things that will creep up near the end they don't get caught off guard. So they're speaking to their financial advisors, they're speaking to the building owners, and they're speaking to, if they're part of a family health team. It's about again, the more prepared you are, the easier the transition is. So the checklist is really just to hold everybody accountable to a timeline and to items that will limit the distractions and roadblocks as we get closer to the patient side of things. So, once we get to the 90-day mark, that's when, at least 90 days before your closure, that's when patients should be receiving their notices. And then obviously once the notices go out as well, you get inundated with calls and requests. So, if we've gone through that checklist and we've managed everything else, then whether the physician wants to handle those calls or if they want to direct them to us, they're not trying to deal with the administrative cleanup at the same time. So again, every physician is a unique scenario. So that's why our checklist is comprehensive. Some of it's not applicable to every scenario. Some of it is entirely applicable. So that's why, I really enjoy working with the physicians, because every practice is unique. Every story is unique. These are all, it's very personal for the physician. So it's very important to me that we're there, we're listening, and we're trying to guide them through the process, because, this is a huge life moment, a moment in their life for these physicians, especially if they've been practicing their whole life, right? They've dedicated their life to caring for a community or a city that they're in. And so, trying to make it as seamless as possible so that they can focus on what matters to them and not worry about like I said, the administrative stuff is where we try to provide the most value to the physicians.
I'm Dr. Jordan Valrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.